being. Assalamu alaikum, Naveed. Welcome and thank you for joining me for a informal discussion about you and your journey to at this point in your career. And I think our fellow Ravelians would love to hear what you have to say. Thank you for joining.
Thank you so much, Farhan. A very good opportunity for me, for rest of the friends, definitely. 20 साल का अरसा है, उसकी कहानी सुनानी है. So basically, I am a general surgeon, a laparoscopic surgeon, and I am a supervisor, teacher of College of Physician and Surgeon. So I've got trainees almost to date. For the past 9 years, to 10 years, I am the supervisor of College of Physician and Surgeon. So I've trained almost 16 to 17 trainees, and I do have 7 trainees right now. So Farhan, cutting it short, it is a long story. We are the ones who, after doing the graduation, who decided to stay in Pakistan because of my family. My parents were sick. They were elderly. They had problems of diabetes, hypertension. So lucky enough, I appeared in Public Service Commission. I got a job, a government job, and a residence also. So soon after the exam, I went for my fellowship, and I opted for a general surgery fellowship. It was my passion, really. Just because in my house job, I loved it. That is the only reason. So once I did general surgery, there was a time we came to know that general surgery has got a very limited future. So we have to do something in laparoscopic surgery. So that was the time I started to have some laparoscopic training here and there. And we had a good setup here in my government hospital. We had got a good number of patients. So now we are doing basic laparoscopic surgery and advanced laparoscopic surgeries. And some bariatric surgery I do with a team. So teaching is another important development in my life, because I love teaching. I've been associated with the College of Physician Surgeons, and I'm chief facilitator for the Primary Surgical Skills Workshop. It's a 3-day primary surgical skills workshop, mandatory for all surgical trainees and surgery and allied specialities. So this workshop is really fun for me, because interacting with the youth, with the young surgeons, and training them with basic surgical skills is, again, it's really amazing. So now we can come, I think, to the direct questions, to cut it short.
Thank you, Naveed, for giving us a good little background. I think you have accomplished a lot, and we'll dig deeper into each topic. My first question is, did somebody force you to become a doctor, or you became a doctor by choice, and what was the driving reason behind that? The driving force?
Well, I think it was a sweet, slow poisoning, sort of, because it was sort of inculcated in my mind, okay, ye hamara doctor banega. And that was from the family, mostly from my father. Allah Ta'ala Jannat Naseeb kare unko. So my late father, he used to tell me every now and then, you're my doctor, you'll become my doctor. He actually wanted me to become a cardiologist. But once I passed my first fellowship exam of surgery, he was really happy with that I opted for surgery.
Well, you have made them proud, and I'm sure your family continues to enjoy your accomplishments. Let me ask you a question. You said you liked surgery, and that's why you became a general surgeon. What really made you a good surgeon and find out that you will be a good surgeon?
Well, it started from my house job, in fact. Uh, there in the house job, surgery was something really what I thought that it gives me some fulfillment when I accomplish a surgical task. You know, it's like you're given a task, you do that task, and the results are there in front of you. This is surgery. Any trauma, any elective surgery. So the results are there and then, right in front of you. So that gives you more energy for to do more and more. So this was the thing, and surgery was my first fellowship, first house job, and during that I saw my seniors. They were spending really good time with their patients. The patients were with pain, so surgery, doing their surgery was the best, the shortest, the easiest way to solve their problem.
Uh,
That is probably the.
Naveed, I have to share something. So when I started my house job, I started surgery, and the reasons you explained that attracted you towards the surgery are the ones that made me run away from the surgery. But
Amazing,
the
amazing.
harder part was holding onto the instruments for hours, long hours. I did a Whipple procedure with Dr. Bhatti. I went to Foji Foundation, and it was grueling. I said, I cannot be a surgeon. But I'm glad you became a surgeon because it takes a lot of physical and mental strength to be a surgeon. So I admire you for that. I couldn't be a surgeon. But knowing
Thank
what
you.
you like and what you don't like is also important to excel in your life because otherwise you are not satisfied.
That
Uh,
is the reason.
so next question is there an event? Well, let me pull back a little bit. So among the surgery, there are general surgeons who kind of do laparotomy, exploratory laparotomies, right? And now you are a super specialized surgeon. You are a laparoscopic surgeon. So what do you do mostly on your work day?
Well, we started with laparoscopic diagnostic laparoscopy, laparoscopic cholecystectomies, lap appendix, lap hernia. This is now a routine in my setups. I do laparoscopic gynecology with my gynecologist colleagues. We do all sort of emergency laparoscopic gynecology. We are doing elective laparoscopic gynecology for the ovarian cyst, for infertility, for pelvic pain, for pelvic adhesions, for tuberculosis is common in my area. So that is again very helpful for my patients. So we divide our ward days and OR days. Mostly we've got 2 to 3 OR days depending upon the load, and two outpatient days. There are certain rounds and some education like for the training of my trainees. There are certain period of time. One day is specified for that. During that, we do some general club and some lectures or presentations.
So Naveed, are you at Ali Medical Center in Islamabad right now?
Yes, my private practice is at Ali Medical Center, Islamabad. My government practice is as Polyclinic, Federal Government Services Hospital. And in Federal Government Services Hospital, I'm there for the past 20 years, and at Ali for the past 5 years after the fellowship.
So how do you divide your
But
day? You must have long working hours.
yes, yes, long working hours. At Ali, I'm for the past 15 years. Uh, I'm lucky. I'm lucky. I've got a home nearby. I just walk to my government hospital and then do the work in the day. There I'm off at 2 p.m. and then walk back to my home, spend some time with the kids, change, um, lunch at times, or at times there is no lunch. So I go back to my private practice at 4 p.m. That is also nearby. It's a 10 minutes drive. So I'm lucky that much of the time that could have been spent in traveling, I'm spending that time with my family.
Wonderful. So it sounds like a good setup, although long hours. What time your clinic ends at the in the evening?
At 7, the OPD is over, and if there is a surgery, suppose a laparoscopic surgery, I do it after that. So maybe I'm free at 8 or 9. At times, I schedule it in the afternoon at 2:30 p.m. So I'm off at 7 almost,
Okay.
mostly.
So you must have privileges at more than one hospital. Polyclinic is where the patients from the polyclinic get operated. And where do you operate as your private clinic for your private clinic?
Well, private setup, I operate at Ali Medical Center. At
Okay.
times, there are other centers which they call me for surgery. Then I go there.
I've
But
heard
that is at times at weekends.
I've heard good things about Ali Medical Center. Can you tell us a little bit about the hospital? Is it a general hospital? Is it a specialty hospital?
Well, the best thing uh, at Ali Medical Center comes from the owner. The owner is running it as this hospital, is Sir Ali Raza. He has run this hospital as a charity hospital. So most of the earning, 90% of the earning of this hospital goes to charity. So he has got great ethics, mentorship, and he's running the hospital with a very good ethical leadership,
Wow.
and that helps really. The first and the foremost thing is patient care. So there is very good collaboration between them, between him and the employees. So that's probably the reason. That's probably the reason that this hospital has got a very good repute, and mostly very senior, competent surgeons they are working. So all those surgeons, they are also trying to be more ethical. So I think patient care is the priority. That is why it has got a very good name.
I'm glad to hear that. Naveed, has there been an event, an interaction that during your training or during your work has changed you as a person, an experience that could be good or bad or could be emotional that you would like to share with us?
Well, dear Farhan, every now or then, uh, I usually quote, surgery is a humbling task.
Mm-hmm.
Every now or then surgery makes you humble. So this is one thing which I try to learn again and again and again. And every now or then you come to know that you have to work more. You have to listen more to the patient. You have to be more attentive to reading the investigation. You have to discuss it again and again with your colleagues. There are difficult cases every now and then. I don't see a single event that could have changed my life, but there are people who I see that they have always followed ethical practice. One is and they are so hardworking,
Yeah.
and they listen so much to the patient that one of my senior, Dr. Javed Saab, uh, he is such a man that he'll stop in the corridor and listen to the patient and solve their problem and take them to his office and help them out. So probably uh, what I have learned very recently is that availability. We are a public property. We have to make ourselves available. Uh, Giving some, work-life balance is again very important. But now we have got WhatsApp and phone calls. This is something, the patients, they are going to listen to you. They are going to come to you again and again. They are going to treat you as a God with a small g, if you listen to them. That is the most, they'll not go to a professor to get themselves operated. The first thing they see, they need is, will this surgeon listen to me? Will this surgeon be available after me, after my surgeries? Will he pick my phone calls? Will he respond to my WhatsApp messages? Probably this is one thing which I have learned in the past few years. I think that is the most important thing.
So what I heard is that you are dedicated to give time to people. You show them compassion. You always show empathy towards their problems, and you are there to show that you care and you respond. And that's a long list of things that a person should do on a daily basis. And with these difficult times that we're going through and everybody's becoming selfish, it's a great message that if you want to be a physician, do it for these reasons, or know that this would be expected of you. So thank you for sharing that. That's
really
a lesson.
I'm honored.
What are the unique skills you have developed within your own field as a laparoscopic surgeon? Is there anything that you think you do better that you could share with others? A technique, a procedure, or maybe anything that you do in your OR that could help someone learn, maybe I should do that. Like,
well, most of these surgeries, we're all self-learners. In Pakistan, mostly we're all self-learners. We were not trained as a laparoscopic surgeon in a lab, unfortunately. But again, I'm trying. We have got lab simulators. Every now and then I arrange lab simulators for my trainees. And that is one thing. Simulation is very important. Training simulation is very important. We should not move forward without simulation-based trainings. This is one thing. And the other thing is in which not just one surgery. The other thing is I would like to be, I think decision making. Decision making is the key. Time management. You do a surgery today in the morning or in the afternoon or at tomorrow in the morning. This makes a lot of difference. You know, in UK and in other places, there is a higher mortality and morbidity um, during procedures or admissions which are done in the at weekends.
weekends and later hours, yeah. Okay.
Yes, yes. So that is, you know, the decision is very important. Probably the heart rate helps you, the investigations helps you. A surgery that can be done um, tonight will save my patient. So this is something I would like to teach my trainees. Because delay has always been catastrophic.
So what I heard is that some of your strengths in your career as a surgeon are that you keep an eye on the vital signs of the patients, and if you know this patient needs surgery, rather than doing it at late hours of night, you try to do it sooner so you can save the patient from a catastrophic event, and maybe not call people on emergent basis, because we all know the outcomes of emergent surgeries are not as good as planned surgery. So that's a valuable lesson. Now, what is the most professionally attractive feature of your current practice setting? It seems like a combination of a hospital and a private practice. Would you,
sorry, can you repeat? Can you repeat, please?
What is the most attractive feature of your current practice?
Well, current practice, laparoscopic surgery, I would again say. And the new thing is the bariatric procedures. I'm doing bariatric procedures with the Cleveland team, and I have found one sweet mentor, uh, uh, a great surgeon, a great clinicians too, Professor Javed Raza. He is one gem of a person. Have done. He is the leading name probably in Pakistan. Uh, mm, Working currently in Dubai. Uh, he is. Uh, uh, he is such a fine surgeon. I tell you. And that is, we can call him a master trainer. So that is something which I cherish right now. It's always amazing to have him around. He visits here every now and then. So I always wait for him, and we are able to do some complex procedures with him.
So what I heard is that in this current setting of your practice, you have a good balance of you serving communities. You also take care of private patients. You have some time with your family, and you have a mentor that you can work closely. So those are the attractive features of your current setting of practice, which are remarkable in a way that you can continue to grow professionally, but also satisfy your current needs as a surgeon.
Amazing. You summed it so well. Amazing,
Okay,
Farhan.
wonderful. Thank you. So my next question is, what is your biggest hurdle or challenge that you face every day? And you feel like, I wish this problem was taken care of better.
Well, again, there are a lot of things which can be done. The first and the foremost thing is availability of space. My government hospital is a smaller setting. We are planning for we were waiting for a bigger area. We had some uh, polyclinic hospital had acquired some land uh, on which there was a multi-story project, but that project has delayed. So probably space. If we can create some space, then we can have a very good surgical floor on which we can teach and train my trainees with advanced laparoscopic skill. I can set a mini lab, or sort of one more thing we can set. And I really miss an animal lab. We do have. I visited Istanbul. They've got a very good animal lab for laparoscopic surgery. Um, um, Again, if not an animal lab, we can have a simulator-based lab in my setting. That is one thing which I would like to accomplish.
Well, I wish that your wishes come true, and with the good interest from your leadership, from your hospital, they build a bigger space for you so that you can actually perform better surgeries, more surgeries, and train more doctors. Now, the next question I have is, what are your personal life and work balance challenges that you feel like the day is too short, I don't have enough time?
Well, luckily, Islamabad is a place where you can travel. You can travel 15 minutes, 20 minutes, 30 minutes, 1 hour, 2 hours, and 4 hours. So there are beautiful places at this travel time, at this travel distance. So traveling with kids, family, friends, that is my hobby. Uh, I usually I'm able to get some time for that, some break for that,
So I
and
feel like
that is I cherish.
so what I hear is that you don't find that your current job keeps you away from your family. You still have a good quality of life with work-life
Yes.
balance. Okay, good. That's very nice to hear, because I have to tell you that most physicians in the world complain of that problem. But I think you said initially that less commute has saved you some time, and that gives you
That
some
is the beauty
extra
of
time
it.
to spend. Now, have you thought of any other future training? Do you have future goals that you will make, time to improve upon your career, Pat?
Well, again, sky is the limit. For this very moment, worldwide, people are trying to do one or two things. Surgeons, they are either doing a single surgery, or they are going to super speciality. Either they are doing upper GI or colorectal or that sort of surgery. In my country, again, um, I've got I've got to do thyroid, I've got to do breast, I've got to do colon, I have to do. So that is in future. I think I'll try to cut short thing, do something upper GI or something like that, or simply laparoscopic colon. I would try to do that, definitely.
I agree with that, that a lot of doctors are becoming super specialists, but
Yeah.
there is great need for generalists too, because if you keep giving up skills of basic surgical skills, you can't help as many people. So I think I agree with your idea of being able to do a lot many surgeries. I know you have a busy clinical schedule. Do you ever get a chance to do any research?
Well, research again, my shortcoming right from the beginning. Um, I spent some time with my colleagues doing their dissertations, and uh, I tried to extract some articles from that. I am recently working with a team which is uh, there are doctors who are public health experts. They are doing some research, community-based research, and on infectious diseases in the surgical patients, surgical ICU. So there are 2 to 3 published papers, or and there are 4 to 5 in the line. So that is something which I've recently joined and I'm trying for the past 3 to 4 years. Recently, every now and then, I try to present my cases on the Surgicons, that is the Surgical Conference of Society of Surgeons. So for the past 6 or 7 years, I'm continuously presenting my papers. They are mostly case presentation or case series, short case series, like laparoscopic diaphragm repair, laparoscopic stomach gastric surgeries, on laparoscopic uh, anoperineal resection, and on laparoscopic anterior rectopexies. So these papers I have presented over here in on the forum of Society of Surgeons. Recently, my paper was accepted for Aga Khan. That was really a great honor in the trauma conference. My paper was accepted, and that was a chest wall reconstruction during acute open pneumothorax. Open pneumothorax due to gunshot. The chest wall reconstruction and is the immediate need. You cannot ventilate the patient, so there and then you have to close the defect, and that was a big defect, huge defect. And what we did, what I did at that time, it was again the emergency is there, middle of the night. What we did is we mobilized the LD flap. So people have done this, but again, this paper was accepted at Aga Khan. So this is again, research is the way forward. Definitely, I'll try to do it more and more.
I have to say you were too modest to say that research is not your area of interest or a piece of cake for you. You have done more than I have done in what you just elaborated. I have to tell you that recently, about a year and a half ago, I came to Pakistan to be with my dad, who underwent the bypass surgery, coronary artery bypass surgery at Shifa in Hara Hospital. And I realized that surgery in Pakistan is a lot different than in the United States because they have really great skills. The care is really good, but how they manage pain is remarkable. We give so much opioids and narcotics to patients, post-operative complications of constipation or uh, post-surgery ileus and those things a lot more. And they treated my dad with only tramadol, and he recovered. He had a couple of days of some periods of hallucination or disorientation. But I think how we approach pain post-operatively is something to learn. And maybe in next session, we'll talk a little bit detail about some things that you do post-operatively to control pain and reduce the use of opioids. Because that's a big problem in the United States, as you may know. Um, my next question is, your what is the underprivileged areas in Pakistan that you would like to see being served or taken care of? I know you live in Islamabad, which is a very developed city. So, any areas?
Actually, my own area, Waziristan, is underprivileged. And what I have done is, there was an operation going on until 2017, 2008 to 2017. The area was cordoned off. So my people were coming to me in Islamabad, and I would have they would come to me, stay here in the hotel or at my place, even at my home, my relatives and their relatives. So and I try to help them, and there is a very good amount of there is good number of community here now settled in Islamabad also, just because they were internally displaced. So these are the people, because I should be able to help them more and more. So what I would love to do is to go to my place, set something there at least, because it's a far-flung area, a difficult terrain, difficult circumstances. So at least I can go there and do some laparoscopic surgery in a month. What I'm doing right now is I got the opportunity. I'm training people in Muzaffarabad in Kashmir. Kashmir is another area, a far-flung area. What we do is, again with my mentor, Professor Javed Sir, I visit there. And again, teachers, they always, you need someone, no matter how older you get. Because at my age even, I see them working there in the far-flung areas. In Muzaffarabad, there is a doctor's hospital, a Midland doctor's hospital. There, I go in a month, once or twice at times, and I teach them laparoscopic surgery. I do a lot of laparoscopic gynecology there specifically, but I would like to do some laparoscopic general surgery also there. So luckily, starting from the house job, we had very good teachers like Professor Abrar Saab, Professor Wasim Sheikh Saab. And here at my setting, we had Professor Beg Saab. Again, they were the people who had great ethics, great work ethics. Then my own professor, Dr. Farooq Malik. He has always helped me out. He was always there, and he has always encouraged me to do more, That is, he was my immediate boss, and he always encouraged everyone, me, especially. He always encouraged us to do more and more laparoscopic surgeries, do the best things which are needed for the patients.
Thank you for sharing that region and mentioning that. I looked it up as you were sharing your story of Waziristan. It's a beautiful landscape, and I agree with you that that's one of the areas where there's need to develop infrastructure, medical care, education, and I hope that you find help delivering that care, the passion you have. Uh, Everyone deserves better education, better
Yes.
health care. Let's talk a little bit about COVID-19 and how it's impacting you. And if you were the chief of your hospital or chief of uh, WHO, how would you deal with this situation differently?
Well, the fear, the fear behind the COVID-19 is immense, immense here. Because in Pakistan, what happened is that we were listening about China. There's something happening in China, and we were waiting and waiting and waiting. And then it started to happen in Europe and America. And we started hearing about mortalities, morbidities, mortalities, morbidities. The first thing we did is in Pakistan is we closed the borders, we closed the airports, and we started to test, to target, to test, and to treat and to cordon off patients. So this is the triple T regime. That was the recommended regime by WHO. The problem with this COVID-19 is that if you ask me what is the best strategy to manage it on individual level or on at an regional level or at international level, again we don't know it. Right from chloroquine to the social distancing and the different methods. So weekly there are the recommendations, they are changing. So one thing is common: social distancing, lockdown, again partial lockdown, complete lockdown. These are all the things which we are listening to for the last 3 months, 2 months almost. In Pakistan, certain area had a complete lockdown. The doctors, the paramedics, they don't had PPEs and all the training and all, but now things are improving. We have started to learn things. Today, almost as if I quote from a source, that there are more than 150 doctors and paramedical staff who are affected by COVID-19. So at this very moment, the way forward is again a lockdown, social distancing. In the hospitals, we should be only doing emergency surgeries, what we are practicing right now. The OPD is closed. The way forward is telemedicine. For the coming at least 1 month. In the coming 1 month, we'll come to know what's the burden of disease in Pakistan, what are the number of cases. The number of cases are rising exponentially, I know. We have got almost 12,000 cases, but we know that Switzerland has 28,000 cases. We all know that there are countries who have got 80,000, 200,000, 300,000 cases. So overall, again, we are all alert. And I think by proper quarantine, we have got space, enough space. We have got workforce, we have got dedication, we have got commitment. Our nurses, our paramedics, they are, they are fearless, dangerously fearless, because and they are committed. So I think this dangerous fearlessness, this should be addressed a little bit. With a proper protection, I think they should approach patient. This is what I would like to do is in my setting to train them that they are brave, but they have to take care. This is something I would like to practice in my setting.
Naveed, what I heard is you mentioned several times the need for personal protective equipment for providers and the first responders. And I think I trust that if you were the chief of your staff, you will invest, or WHO president, you will invest in more personal protective equipment for healthcare for the future, so that another COVID infection happens, you will be able to protect them. And what I heard also is to be more careful. What you're advising people is to actually learn from experiences such as America. American population has the largest number of cases currently infected with COVID-19, and I just looked it up, it's over 961,000 cases, so we are about to hit 1 million. There are almost 55,000 deaths in the United States, so I think I agree 100% that we need to, this is one thing that we don't need to repeat, we need to learn from other experiences, and it is always smarter to learn how others have done. And one of the interviews I did earlier, and I'll share with you all, is um, countries where, like Saudi Arabia, I was talking to Asfar, and he said that they were quickly implementing protective measures to, avoid the spread of this infection. Great, thank you for sharing your concerns and ideas. Now, later part of our session is 5 questions that I'll ask you. If you, first of all, if you were not a physician, what would you be? What would you have become?
Well, again, very difficult. Maybe a pilot. Always wanted to be one.
You are not alone in saying that. Because Farhan Siddiq also said the same thing.
So we joined this.
You both are surgeons, and both are surgeons. So I think surgeons need the thrill, the release of catecholamine release that they get from the thrill of operating.
But, but I don't drive fast. I would like to really, I don't become a pilot when I'm on the driving seat of my car, but that would have been one thing, always a passion. I really loved it.
Okay, good. Will you recommend your loved ones to become a doctor?
Yes, always. Because this is something which at the end of the day, gives you that satisfaction that there are people who are going to praise you like a god, or who are going to pray for you. There'll be people who will be praying for you. There'll be people who will be looking towards you. There'll be people who will always be thankful, grateful to you.
Thank you for sharing that. I agree with a lot of things you mentioned. If you had a chance, would you want to be a celebrity physician, maybe treating the actresses and actors and models and maybe politicians of Pakistan, and be in the media and interviewed a lot?
Well,
do you like fame and being famous? And
being famous, yes. Actually, my friends have made me famous on Facebook. They're always there. They're always there, and every now and then I poke them, and they come up with sweet comments. And that is something which, I really cherish.
I lost your screen for a second. Okay, now I got it.
Yes.
Good. All right. So you're already famous, and you're enjoying that.
I enjoy it. And there is a reason for that. And again, there is a reason for that. In Islamabad, I'm sitting in Islamabad. We've got M&As, and they come to me. and I operate upon them. There are other celebrities, they visit to me in my private settings or in the government settings. So I really cherish them, cherish it. And there is one more reason. If you have got something good to say about your profession, about your experience, say it. Say it to your near ones, to your students, to your colleagues, to your to the world, to everyone, definitely. So if I get a chance to talk to every person out there, I would love to. I
I
would love to.
I
I would
like
love to share my experience.
yeah, and your enthusiasm and your desire to help, because right now these days healthcare providers are the heroes, right? We are the ones who are actually taking care of people, and like yourself and nurses and other paramedics. Let me ask you two more questions. What is your favorite destination for travel or vacation?
Well, inside Pakistan, it's Naran,
Okay.
the Naran Babusar Road. And I invite everyone out there, my friends. You know, I can take you there, free ride, whenever you whenever you come to Pakistan. It's an open invitation on a weekend, and now there is a motorway, and we can reach there in 5 hours. So Naran, Babusar, Lake Saiful Maluk, do travel there. Do go there with your family, and do and it's an open offer to all friends abroad. You know,
Wow.
I'm there. I'll
We
take you
will
there.
take you up on this offer, because
Please, please.
we may not be able to arrange to go there ourselves, or uh, may,
I'm there. I'm
yeah,
there.
we will
I'm
take
there.
up that offer.
My It's a free pick and drop, and other boarding and even food.
Man, you're
Yes,
generous.
I
Thank
can
you. God
sponsor
bless
that.
you. You're
I
generous.
can sponsor that for everyone out there. And the second is international distant destination. I love Sultanahmet, Sultanahmet, and I love Istanbul, Istanbul,
So is
the feet,
Sultanate,
the history.
is it a part in Istanbul? Is it a
Yeah, the
the
ancient.
old? Okay.
Istanbul.
Wow.
There are two parts, the European and the Asian, but the Sultanahmet area, that is lovely. The where the Blue Mosque is, I love that place.
Beautiful.
I can I can
Maybe
visit that place.
you can be our guide for Istanbul too. Seems like you know
Most
quite.
welcome, most welcome, Istanbul, and even for the hot air balloon ride, I would always recommend go to Goreme, go to Caesarea. It is a day trip. Go to Konya. Go to Konya at the
Rumi,
Maulana Room.
Rumi's, yeah, Malana Rumi's.
At the Maulana Room, you go there, you get an amazing feeling. And do read some. At least I think do read at least 10 sayings of Rumi before you visit them that area. Then you can cherish it more.
Thank you for sharing that. He's one of my. Uh,
That is a must. You living in the cave city there, and I tell you, once you go there, you get two breakfasts, one at 5 a.m. and one at 9 a.m. That is the most beautiful part of it. And international travel, I love the breakfasts.
Wonderful. Thank you for sharing. That is really interesting.
Yes,
Uh,
yes.
what do you do to keep yourself in a good mind and body state? You seem very
Currently,
satisfied. You look healthy. What do you do?
well, I would love to do more walk, some exercise. That is one deficiency. And what I do is I try to be happy. I share happiness, and I also spend more time with kids, and that is amazing. I've got two kids. My brother's has got three kids, and so we all are in a joint family session. So we always love that. playing,
See some
spending time with kids.
pictures of your kids.
That
Yeah,
is
the
lovely.
videos that you shared, beautiful kids. I'm so happy that you get a chance to enjoy them.
Really.
Naveed, thank you. We will finish the recording. Stay online for a few more seconds for me to wrap up with you on a personal note. But thank you for sharing these.
One thing I would like to add at this time, Farhan, in the recording, that when I came to know that you're going for this interview session, I thought it may not be that much interesting, but the question you have formulated, the pattern is amazing, and after this interview, the first thing I'm going to share on the group is that everyone should join it. It's really lovely talking to you, and you took me through this interview so easily. I think we've been talking for the past 1 hour. I don't know.
Yes, about 1 hour. Yeah, and I
About
enjoyed
1 hour.
every minute of that.
And Farhan, I think this is your skill. This is your skill. Well done. Well
Thank
done.
you. Thank you so
You did
much.
it so well.
And I
You did
would
it so
love
well.
to do another round of more deeper interviews with you guys. And I hope that we get to know more of each other on a personal level. Thank you, Naveed.
And my Naran offer is still there.
I will take you on
To
that.
you especially. Most welcome.
Okay, thank you.